What factors affect osteosarcoma bone cancer prognosis? What factors influence the prognosis of osteosarcoma, a type of bone cancer? Understanding these factors can help patients and families navigate this challenging diagnosis. Several key elements play a role in determining survival outcomes and treatment success. First, age at diagnosis is significant. Younger patients, particularly those under 12 years old, often have a better prognosis compared to older adolescents and adults. Survival rates tend to decline with age, especially in patients over 65 years old. Next, gender can also affect prognosis. Research indicates that male patients generally have poorer outcomes than females. This difference may relate to various biological factors and how tumors respond to treatments. Tumor size is another critical factor. Larger tumors, particularly those exceeding 16 centimeters, are associated with worse prognoses. Smaller tumors typically lead to better disease-specific survival rates. The location of the tumor matters too. Osteosarcomas found in the arms and legs usually have better outcomes than those located in the trunk or near the center of the body. Tumors in non-extremity sites tend to present more challenges. The presence of metastasis at diagnosis is a major concern. If cancer has spread to the lungs or other distant sites, prognosis worsens significantly. Patients without metastasis generally have much better survival rates. Another important aspect is the histological response to chemotherapy. The degree of tumor cell death after preoperative chemotherapy is a strong indicator of prognosis. A good response, defined as 90% or more tumor necrosis, correlates with improved survival chances. Surgical options also play a role. Limb salvage surgery, which removes the tumor while preserving the limb, is often associated with better outcomes compared to amputation. In fact, a lack of definitive surgical treatment is linked to poorer prognoses. Lastly, certain molecular and cellular markers can influence tumor behavior and treatment response. For example, the expression of proteins like human epidermal growth factor, receptor 2, CXC chemokine receptor 4, and P-glycoprotein can affect prognosis. Understanding these factors helps healthcare providers tailor treatment plans and offer more accurate survival estimates. However, it is essential to remember that prognosis can vary widely among individuals. Ongoing research continues to refine these predictors. Patients should always consult healthcare professionals for personalized evaluation and management.